Hello everyone. In this video, I would like to discuss about age determination with ossification centers of bones. So they may give a history which they may mention about the ossification centers of various bones in the X-rays, and they will ask you to find the approximate age. And the same thing is asked as an exercise in your forensic medicine practical exams. In this video, I will be explaining three things. Number one, ossification centers of important bones, appearance age and fusion age. Number two, at different ages, what X-rays we have to take so that we can find the age correctly. And third thing, a finally quick revision about all the appearance and fusion of the ossification centers, of various bones. Without delay, before going into the topic proper, there are some certain rules you have to keep in mind. Number one, when the embryo is or the fetus is at 11th intrauterine week, there are about 806 centers of bone growth. At birth, we have around 450, but remember our adult skeleton has only 206 bones. The union of bone is not an event, that means it does not take place at a single day. That is why, while giving the age with the help of an X-ray, we have to always say the age in a range. We can't say the X-ray of this patient. When they give an X-ray of the patient, we can't say firmly that this age is 16 years or 17 years. We can say it is 16 to 18 years. Why? Because union is a process. It is not an event. Okay. So that is why we are giving the age in a range. That is very, very important. Or we can say, it is not less than 12 years. Or the age is more than 16 years. More than 16 years. I can't say whether it is 20 or 30. It is more, but it is more than 16 years. Why? Because at a particular point, that bone ossification centers in the bone might not have fused. But after 1 week, if you repeat the X-ray, the epiphyseal line would have fused. Fine? Okay. As a general rule, remember the aging of bones is more accurate with the respect to appearance of centers of ossification than with respect to the union of epiphyses. But remember, for our exam purpose, we will mainly remember the age at which the ossification center undergo fusion rather than appearance. Appearance is of limited importance for us. Remember, in upper limb, union occurs first in the elbow, then in the wrist. Okay, whereas in the lower limb, union occurs first in the hip and ankle joint and later at the knee joint. How you can see this unfused ossification center or unfused epiphyseal lines? The unfused epiphyseal or the epiphyseal lines, that is the line of fusion. They will always appear like an irregular line, like a fracture line in the X-ray. Okay, that is how you have to identify it when they give X-rays for your practical exams. So let us start with the first bone, that is the clavicle. Remember, clavicle, the ossification centers fuse by 20 to 22 years. 20 to 22 years. Okay, fine. Next, remember sternum. In sternum, you have to remember between the segments of body of sternum, fusion occurs by 14 to 25 years. That means we all belong to this age group, right? 14 to 25 years. That means our segments of the body of sternum will be fusing at this time. But remember, which part of our sternum will not be fused at our age? Xiphoid process. Okay, xiphoid process fusion occurs only by 40 years. So 14 to 25 and 40. Finish. See, two bones we have finished. Third bone is hip joint. That is our ischium, ilium and pubis. Out of that, only one which is extremely important is ischial tuberosity. When we see that ischial tuberosity is fused in an X-ray of a hip joint, the first thing I can say Pakka is the age is more than 21 years. More than 21 years or more than or equal to 21 years. Why? More than or equal to? I told union is a process, not an event. So ischial tuberosity, it is 20 to 21 years. Third bone also finished. Okay, third bone also finished. And remember, and another one important thing, this is something called as triradiate cartilage. Triradiate cartilage. This fusion occurs by 15 years. Okay. MCQ they may ask, not important for your main exam. Okay, MCQ, triradiate cartilage, 15 years. Okay. Then coming into femur, tibia, fibula, humerus, radius, ulna. Very easy, very easy. 6 bones we will finish in 2 minutes. See, remember, just keep this picture in mind. This is the upper end of the femur. Okay, hope you know the parts of the femur. Okay, parts of the long bones. This is the lower end of the femur. Again, this is the upper end of the tibia fibula. This is the lower end of the tibia fibula. Remember, three values. What are they? 16, 17, 18, 19. These are the four numbers you have to remember. Okay, 16, 17, 18, 19. You can remember these values from above downwards or below upwards. Just remember in anatomy, as per anatomy, from above downwards. Upper end of the femur, fusion. I am telling only fusion. Okay, I am not telling appearance. Appearance only, carpal bones appearance is important. Rest all fusion years only important. So 17 to 18 years, upper end of the femur will be fused. Okay, upper end of the femur will be fused. Okay, if it is unfused only, we will see as an irregular lines in radiograph. If it is fused, we won't see such lines. Lower end of the femur and upper end of the tibia fibula. Remember together, lower end of the femur and upper end of the tibia fibula, both will be fusing by 18 to 19 years. 18 to 19 years. Lower end of the tibia fibula will be fusing by 16 to 17 years. So 17 to 18, 18 to 19, 16 to 17. Okay, finished. So femur, radius, ulna, finished. Then coming into, humerus, radius, ulna. Okay, humerus, radius, ulna. Again, upper end of the humerus, lower end of the humerus. Okay, upper end of the radius ulna, lower end of the radius ulna. Very easy. Again, 18 to 19 years. 18 to 19 years. Where else we see 18 to 19 years? Lower end of the femur, upper end of the tibia fibula, 18 to 19 years. Upper end of the femur, it is 17 to 18 years. Lower end of the femur, tibia fibula, it is 16 to 17 years. So 17 to 18, 18 to 19, 16 to 17. Okay, just remember like this. Fine. Yes, of course, this value you have to by heart. There is nothing called as understanding, but we can by heart in a smarter way. That's it. Okay. See, upper end of the radius, upper end of the humerus, it is 18 to 19 years. 18 to 19 years. Then other things will become very easy. Lower end of the humerus and upper end of the radius and upper end of the radius and ulna, it is almost the same. So I can say it is 14 to 17 years, because in textbook it is, remember, here it is 14 to 16, it is 16 to 17, it is 16 to 17. So for our remembering easy purpose, so I can say it is 14 to 17 years. 14 to 17 years. And remember, lower end of the radius and ulna, it is here, it is mentioned 18 to 19 and 17 to 18. So I can say it is 17 to 19. Okay, 17 to 19. So upper end of the humerus, 18 to 19. Lower end of the humerus, upper end of the radius and ulna, it is 14 to 17. And lower end of the radius and ulna, it is 17 to 19. Okay, it will look a bit confused. Don't worry, at last I will be writing everything in a single page, and so that it will be very easy for us. Okay. Then coming into carpal bones, extremely important. Here only the appearance age is important. Capitate appear by 2 months. Capitate appear by 2 months. After capitate, hamate also appear by 2 months. Okay, so 2 months, 2 months. Actually, some book says hamate is 3 months. Okay, so you can both ways. Okay, capitate, hamate. Very easy to remember. This is 2 months. This is 3 months. Then another two bones is lunate. Before that, triquetrum. Okay, triquetrum and lunate. 3 years, 4 years. 3 years, 4 years. Then what else? After 3, 4, it is 5 and 6. Trapezoid, then trapezium. Trapezoid and trapezium. How I remember? I comes first, U comes next. Okay, U is the last alphabet now. So that is why trapezium is 6 years and trapezoid is 5 years. Okay, finish. Another very, very important thing, pisiform. Okay, 12 years. How I used to remember? Pisiform. Pisiform bone. The word pisiform bone has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. It has 12 letters in total. So pisiform bone appears by 12 years. When you see pisiform bone in an X-ray of hand, you can say it is, or the X-ray belongs to a boy or a girl, but more than or equal to 12 years, or more than or equal to 11 to 12 years range. Okay, always say the age in range. Then coming into another very important thing, that is the fusion. Okay, the fusion of this. What is this? This is the first metacarpal. This is the first, second, third, fourth, fifth. First metacarpal fusion. It is 15 to 17 years. Okay, it is 15 to 17 years. Very, very important. Okay, very, very important. And remember, the interphalangeal joints, everything, all those fuses by 15 to 18 years. 15 to 18 years. Okay, first metacarpal alone, you remember, it is 15 to 17 years. Rest everything, the interphalangeal joint, everything, it is 15 to 18 years. Okay. As far as tarsal bones are concerned, okay, tarsal bones are concerned, remember, there are 3 bones, okay, there are 3 bones which are present within, that is what, 1 year. That is, calcaneum is 5th month, cuboid is 9th month, talus is, 7th month. Remember, like C, T, C, 5, 7 and 9. Calcaneum, talus and what, cuboid. Okay, 5, 7, 9. Then we have 3 cuneiforms. What are they? Lateral cuneiform, medial cuneiform and middle cuneiform. Okay, lateral cuneiform, medial cuneiform and middle cuneiform, which you can remember like 1, 2, 3. 1, 2, 3. Okay, yes. And here again, okay, the first metatarsal fusion is 17 to 20 years. Okay, 17 to 20 years. Here it is 15 to 17 years. 15 to 17 years for first metacarpal. For first metatarsal, it is 17 to 20 years. Just remember this. Rest everything is not needed in case of tarsal bones. Okay, so now I have completed humerus, radius, ulna, femur, tibia, fibula, hip joint, clavicle, sternum, carpal bones and tarsal bones. Okay, this is in gist of the basic ossification centers, appearance and fusion. Appearance mainly for carpal and tarsal bones, fusion in case of rest of the other bones. Okay, and using this knowledge, we are going to see present it in another way. By the fifth year, greater tubercle of the humerus fuses with the head of the humerus. Okay. But what I told, the upper end of the humerus, in general, okay, this is the fusial line, epiphyseal line. It is how many years? 18 to 19 years. Okay, just remember this, 18 to 19 years, this is enough. In this table, there are a lot of values and things are mentioned, but what needed for us, we will revise. Okay, here I told 20th to 21st year, what is it? Ischial tuberosity. 21st year, always remember ischial tuberosity. Okay, yes. Then triradiate cartilage. Can we go back to the picture? Triradiate cartilage. See what I told? Triradiate cartilage. What is the age of fusion? 15 years. That is what they have written here in this table. 15th year triradiate cartilage. Why? When they give an X-ray, look the triradiate cartilage. If you can't see triradiate cartilage, you can see, of course, this is an X-ray of a boy or girl belonging to more than or equal to 15 years, because triradiate cartilage is not seen. Not seen means triradiate cartilage has fused. That's it. Okay, fine. If you see in the ossification, that if you find that ischial tuberosity is completely ossified, what you can say? It is belonging to a boy or girl which is more than or equal to 20 to 21 years. Fine? Yes. Similarly, using the knowledge, lower end of, you can see this, you can apply the same thing for lower end of the femur, upper end of the tibia fibula, lower end of the humerus, upper end of the radius ulna. All this you can apply, whether you can see the fusion line or not, and based on that you can find the range of age. Based on that you can then find the range of age. See pisiform. Appearance. Yes, the pisiform is appeared. I can see the age of the boy or girl, the X-ray belongs to the boy or girl whose age is more than or equal to 11 to 12 years. Okay, this is how you have to come to a diagnosis using appearance of centers of ossification and units of bones and epiphyses. Okay, fine. There are certain things you have to remember as far as skull is concerned. Okay, skull is concerned. Okay. Remember one point, suture closure occurs later in females than in males. The last suture to close is squamous part of the temporal bone, which occurs by 60 years. Remember, Cephaloid process, 40 years. Lambdoid suture, it is 45 years. Rest of the suture, it is optional. If you can remember, you read from book, not necessary. Fine. Sacrum becomes a single bone between 21 and 25 years. That is our age group. Now we are in a current age group. Now only our sacrum is completely being fused to form how many? As a single bone. We have sacral 5 segments are 9, S1, S2, S3, S4, S5. Yes, now only they are fusing. Okay. Yes. Scapula not needed. Yes. Next comes a very important. For estimation of age between 6 to 12 years, we can take an X-ray of elbow joint, wrist joint, or center for just remember elbow joint and the wrist joint. 6 to 12 years, what X-rays you will take? Elbow joint and wrist joint. For 9 years, okay, main you have to see the trochlea of the humerus. 10th to 11th year, see the pisiform. I told you pisiform 11 to 12 years. Yes. For 13 to 16 years, always see elbow joint and pelvis. 14th year, see the crust of ilium. 16th year, see ischial tuberosity. Ischial tuberosity. Okay. Yes. Suppose if you are just trusting on the joints, 16 years means see elbow joint. 16 to 17 see ankle joint. 17 to 18 hip joint. 18 to 19 knee, shoulder and wrist joint. 20 to 21 years fusion of the iliac crust, ischial tuberosity and the inner end of the clavicle. Okay, fine. I always told finally we have to make a diagnosis, that is which age group the X-ray belongs to. That diagnosis should be based on multiple X-rays of the joint. With a single X-ray of elbow joint, we can't come to a diagnosis or a conclusion that this is age of the patient. That is why multiple X-rays of various joints are necessary. Okay, and always give the age in a range. Just remember 16 years elbow joint. Okay, 16 to 17 years ankle joint, 17 to 18 years hip joint, 18 to 19 years knee, shoulder and wrist joint, 20 to 21 years fusion of iliac crust, ischial tuberosity and inner end of the clavicle. Okay, fine. Now we are going to just revise this. Okay. So, clavicle 20 to 22 years. Sternum, xiphoid process is 40, whereas the segments of the body of the sternum it is 14 to 25 years. In pelvis, remember two things. Triradial cartilage is 15 years. Ischial tuberosity is 20 to 21 years. Okay. Then coming into our three easy bones. What is it? Upper end of the femur, lower end of the femur, upper end of the tibia fibula. Upper end of the femur it is 17 to 18 years. Lower end of the femur, upper end of the tibia fibula it is 18 to 19 years. So automatically what will be the fusion age of lower end of the tibia fibula? 16 to 17 years. Okay. So 17 to 18, 18 to 19 and 16 to 17. Okay. Coming into humerus, radius and ulna. Upper end of the humerus it is 18 to 19 years. Now I am asking you what is the age group of fusion of upper end of the femur? It is 17 to 18 years. Okay. Then coming into so upper end of the humerus it is 18 to 19 years. So what is the age group for lower end of the humerus, upper end of the radius, upper end of the ulna? It is 14 to 17 years. Then comes automatically what is the age group of fusion of lower end of the radius and ulna? It is 17 to 19 years. So 18 to 19, 14 to 17, 17 to 19. Okay, just remember, see, it looks like continuous numbers, no? That is why I have explained in such a manner. Okay, so just remember like this. Okay, because at last in the exam, what you want to is you have to remember approximately at least the range of age group, not like definitely like 16 or 17. You can at least remember, okay, it is some 14 to 17 or 16 to 17. At least if you remember like that, you can come to a diagnosis both for your practical exam as well as in theory exams. Okay, fine. Then carpal bone, capitate, hamate, 2 months, 3 months. Trichotrum lunate, 3 years, 4 years. Trapezoid, I comes first, no? So 5 years. Trapezium, U comes second, no? So 6 years. Pisiform bone has how many letters? 12 letters. So what is the age of fusion? 12 years. First metacarpal, 15 to 70 years. Then comes the question, what is first metatarsal? It is 17 to 20 years. Okay. So CTC, calcaneum, talus, cuboid, 5, 7, 9. Lateral cuneiform, medial cuneiform and middle cuneiform, 1, 2, 3 years. Okay, the calcaneum are in months, whereas this cuneiform is in years. Then remember, what is first metatarsal? It is 17 to 20 years. Then xiphoid process, 40 years. Squamous part of the temporal bone, 60 years. Lambdoid suture, 45 years. Ischial tuberosity, 21 years. Okay. Then sacrum becomes a single bone between 21 and 25 years. Okay, so this is how the complete ossification centers in the bone. Now let us go for a rapid fire. Okay, I am showing this picture. With this picture itself, I am going to ask. Okay, xiphoid process, 40 years. Upper end of the radius and ulna. It is same as lower end of the humerus. What is it? 14 to 17 years. Then you are going to tell lower end of the radius and ulna. It is 17 to 19 years. Upper end of the humerus, 18 to 19 years. Upper end of the femur, 17 to 18 years. Lower end of the femur and upper end of the tibia fibula, 18 and 19 years. So lower end of the radius, tibia and fibula will automatically becomes 16 to 17 years. Okay, fine. Ischial tuberosity, 21 years. Sacrum becomes a single bone between 21 to 25 years. Okay, so two changes are happening in our body, in our age group. What are they? The bodies of the the segments of the body of the sternum is fusing in our age group, and the sacrum is becoming a single bone in our age group. Okay, fine. So remember, pisiform bone, 12 years. First metacarpal, it is, always remember, it is 15 to 17 years. I am stressing again and again. Okay, they will put this as a hint, 15 to 17 years. At the same time, it is 17 to 20 years in the case of first metatarsal. Okay, so with this, I have come to the end of this video. Thank you.